Okay, we're going to be talking about stroke. We're going to, by the end of this, you should be able to define what a stroke is, right? You'll know what the symptoms are of a stroke, and you'll know how to use the NIH stroke scale and a basic assessment, a fast assessment of a stroke. Sometimes you'll see stroke called a brain attack, at least I've seen that in your book. You'll see them called CVA for cerebral vascular accidents. And you'll hear of TIAs, transient ischemic attacks, and TIAs resolve on their own. So what is a stroke? There's damage to part of the brain with neurological deficit. If you have damage to your brain, you're going to have neurological deficit. That's kind of common sense. There's two main ways that you can end up getting a stroke. One is ischemic stroke, and it's from ischemia, which means that maybe a vessel has narrowed, or you've got a blood clot, or maybe you don't have good perfusion to the brain, but for some reason an area of the brain is not getting the blood supply that it requires. Brain tissue is very, very sensitive to loss of blood supply. There's a lot going on in the brain. It's firing all the time, right? It needs a constant supply of blood, of both oxygen and glucose. And the other way a stroke can happen is hemorrhagic stroke. You get bleeding. Vessel pops for some reason and you start bleeding into the brain. You end up with tissue damage and neurological deficit. Right? One's from ischemia, the other one's from the bleeding right into the brain. Okay, right here I've got a brain drawn here on my whiteboard, and you can see the frontal lobe out here, and that controls your thinking, memory, speak, and motor control. So when you get damage out here, these are the things that you can see deficits in. Parietal lobe is here in purple. Parietal lobe, and language and sensory. And then right here is the temporal lobe in blue, right here in the middle. Hearing, feeling, and learning. And there is this black mark here that I went out, and that's called, it starts with a W, but it's pronounced Wernicke's, is how I hear it pronounced anyway. And this is word use, how you use your words, right? How you can put together a sentence. When there's damage to that area, you might show them a picture of a glove and say, hey, what is this? And they'll say a pencil, right? Not even realizing that they're not saying the correct thing. This green area here is the occipital lobe. You have vision and color perception in the occipital lobe. And then right down here, outlined in red, cerebellum. And there you have your sense of balance and coordination of movement. Right? That's the one that if you're going to reach up and grab something, it's the cerebellum that coordinates all that movement. And then over here, I've got Broca's area, and it's for articulating words, right? Now up here is language also, right? This one here is getting the right words. This one here is being able to pronounce the words. You might know the right thing. Show the picture of the glove. You might want to say glove, but you can't say it. Right? Can't say it. You know what it is. You know the word that you want to say, but you can't say it. Wernicke's, though, is they don't even know the word that they want to say. Or they think they know it. They say a word, and it's just the wrong word. They're pulling the wrong word out of the brain there, so it's not working right. And you do have the brainstem here, and the brainstem, I didn't write anything down there, but that's very important because through that brainstem is where a lot of your autonomic stuff happens, right? Telling yourself to breathe, telling your heart to beat, right? All these kind of things happen. Temperature control, all that stuff happens there through the brainstem. Okay, there's a couple acronyms here that you can use for your initial quick assessment of the patient. And one of them is FAST. F-A-S-T. By the way, speed is the name of the game when you're taking care of these people. And this here's the face, right? Their facial features, are they symmetrical? You can have them smile for you too and see the movement symmetrical. Arms and legs, right? Can they move their arms and legs? Speech, S is speech, right? Is their speech clear? Are they able to communicate well? And T is time, and that's in there because it's very important. You need to notice the time that they came in, and you need to find out when they first had symptoms because you need to know that for treatment. I used to use an acronym called FLEAS, and this is FLEAS, F-L-E-A-S, face, level of consciousness, their eyes, pupils, equal and reactive, do they move their eyes and follow, and arms and legs, can they move their arms and legs, and speech, is their speech clear? So it's just got, in addition to the FAST, you've also got the eyes and the LOC. Real quick, I'm going to go through the NIH stroke scale, National Institute of Health stroke scale. Now you can find this scale in any med-surg book, I would say, as long as it's not a real ancient one. You should be able to find it in the stroke section, whatever area they're talking about, cerebrovascular accidents. You should be able to find the NIH stroke scale and look through it, or just Google it. I'm sure there's probably a whole bunch of them on the internet. What it is it's a scale where you can quantify the severity of a stroke. And you can have one caregiver using this scale and the next caregiver using it again. And as long as they're trained, you can get a pretty consistent flow from caregiver to caregiver to caregiver. It consists of 11 different steps, and they're all numbered, and then you end up with a number. The higher the number, the worse the patient, right? It's generally how it is. First one is their level of consciousness. If they're alert and oriented, they got a 0. If they're not alert, but they're arousable to minor stimuli, right, you can kind of tap them on the shoulder and kind of get them to, look at you and say, yeah, whatever, they get a 1. Now, if they're not alert and they take a lot of stimulation, got to kind of shake them, and then they kind of open their eyes, and then they're kind of back and close their eyes again. You got to keep on them to get them to look at you and to make them respond to you. Then they get a 2. If they're unresponsive totally, they get a 3. So the second part of the scale in a level of consciousness is that you ask them 2 questions. Ask them their age and what month is it. If they answer them both correctly, they get a 0. If they answer only one of them correctly, they get a 1. If they answer both of them incorrectly, they got a 2. And remember, no coaching on this stuff, right? They either answer question correctly or they don't. And now on the level of consciousness, the third part of the level of consciousness is, can they follow commands? Right, if they're laying there with their eyes closed, just ask them to open their eyes and reach up and grab my fingers here and squeeze them. And if they're looking at you, ask them to close and open their eyes and then to reach up and grab your hands. You hold your hands out like that, have them reach up and grab them and squeeze. And if they do that, they get a 0, right? If they do both things, they follow both of those commands, they got a 0. If they perform one of them incorrectly, they get a 1. If they perform both of them incorrectly, they got a 2. And in this one here, you aren't trying to see if they have the motor ability, or you're trying to see if they follow commands. You're checking their orientation, you're checking their level of consciousness. That's the word I should have used. So anyway, if they attempt to, you score them that they did it, right? If you say reach up and grab my hands, they just kind of pick them up and kind of drop their hands like I'm too tired. Okay, this isn't the place to score them down for that. So they did it, right? They heard what you said, they're following your command. Now, best gaze is the next category you're going to see there on that scale if you happen to find one somewhere. Here you're going to have them follow your finger, right? So you put your finger out there and you say, follow my finger here, and you move your finger from side to side, right? And so as you do that, their eyes should move. Now you tell them not to move their head, just move their eyes. So you want to see if their eyes have that lateral movement, right? To side, full lateral movement, they got a 0. If they can kind of move one way, but they can't get across the midline very well, but maybe one eye goes over and the other eye kind of partially over, they can get a 1. If they can't cross midline at all, or their eyes don't move, they get a 2. Right, so they should be able to cross the midline on both directions. Right, so now we're going to check their visual field. Right, so And I will talk a little bit more about visual fields in a different video. But anyway, so you'll kind of hold up here and you'll say, can you see my fingers? Yes. How many am I holding up? And they'll tell you, how many am I holding up now? Right, so you're going to check 4 fields, right? So if they see them all, there's no loss. They got a 0. If they only have one, like they can see down here, but they can't up here, right? Then that's a quarter. So then they would get a 1. Now if they can't see here and they can't see here, then they would get 1. Then they would get 2. And if they can't see on either side, that means they're blind. They get 3. Okay, so the next thing we're going to check there is facial palsy. Normal and symmetrical, 0. Minor paralysis, that might be a little bit of drooping in the mouth. That's usually where you'll see a real minor paralysis. Maybe a little bit here, and one eyelid is heavy compared to the other. And a good thing too is to always ask the family, you know, he's a little asymmetrical. See how the mouth is this? Because they might say, oh, he's always like that. Oh, he's had Bell's palsy. He's always like that. You know, I mean, because people aren't always completely symmetrical. In fact, they usually aren't. I mean, it's from my experience. If you really start looking at faces, you'll see that very often they're not. So you might need the family if it's a really close call. Now when you get to partial paralysis, you actually see a real droop. You can tell it's drooping there, it's drooping here, right? And when you see that drooping, then they get a 2 on that one. The minor was a 1, this one would be a 2. And complete paralysis of one side, when they smile, this side goes up, this side just hangs there, doesn't move at all. That's a 3. So you're going to check their motor drift. You'll have them hold their arms out like this with their palms down. If they can hold them up like this for 10 seconds, they're good. You have a little bit of a dip here and there, they're still good. But if they kind of start drifting down, but not all the way to the bed, then they got a 1. If they drift down and all the way to the bed, then they got a 2. So not all the way to the bed, a 1. All the way down to the bed is a 2. If you hold them out like this and their arm just kind of drops, and now that's a 3 if they can move it to the side. If it like this and it drops, and you ask them to move it to the side and they can't even do that, then it's a 4. Okay, so limb ataxia is the next one. Now you're looking for, you know, the cerebellar thing, right? Lesion back in there with coordination of movement. So you're going to ask them. What I always do is I hold my finger up like this, and I say, will you touch my fingers and touch your nose? Do that 2 times. Right, so that way they touch my fingers, touch your nose, touch your fingers, touch your nose. Then you know that they're able to do that, and you're testing for coordination of movement there. And then for the lower extremities, you will have them, I mean they're laying in the bed of course, but you will have them take one foot, the heel of one foot, and slide it up the leg. And you'll have them do it on the other side, and you'll have them do it on the other side. Slide it up and back down. A lot of times when you're there, you got to kind of pick their foot up the first time and show them the movement, because it's kind of hard to explain unless they can look down and you can show them right there, you know, what you want them to do. But you're checking for coordination of movement there, cerebellar, right? Sensory. Parasites with a cotton swab on one side, then the stick end of the cotton swab on the other for sharp. So dull and sharp. And you're going to ask them, touch them on the sides of the forehead, and close their eyes, touch them here, touch them in the arms, touch them down in the legs, sharp or dull, sharp or dull. Now if they can feel them, but they can't really distinguish between sharp and dull, they got a 1. If everything was right, then they got a 0, but if they can't distinguish them, then they got a 1. No sensation at all, they don't feel it, they got a 2. Okay, the next one then is best language. Have them name pictures, little pictures of a glove and this and that, blah, 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 and they can name it. You got little cards and you'll have them read it. It's simple reading, you know, but see if they can read these cards. And if they should be able to and they can't, then you can figure, okay, there's something wrong with their language. No aphasia, they named everything, right? They recognized the glove, they recognized the key, they recognized a pencil, right? That's 0. A 1 would be if they recognize less than half of the stuff, and half of the stuff they miss, because these are simple things. They should be able to get it, right? A 2 means that they missed more than half, right, of the things. And a 3 means they're mute. They can't say anything. Okay, dysarthria, right? Whether or not they're able to articulate their words, right? And then remember, that was the Brokaw's area that I showed you right here, right? So if there's damage to that area, they won't be able to say the words. So we already checked to see if they recognize things in the right words. You know, when they wanted to say key, did they say key or did they say glove or something else? Well, now we're seeing, can you actually say these words? So you give them words that take a little bit of coordination in order to say. You have them say mama, you have them say tip top, you have them say 50-50, you have them say huckleberry hound, or I think it's just huckleberry. I always said huckleberry hound, and I'm pretty sure it's just huckleberry. And you have them say baseball player. They say them all right, they got a 0. Slur a little bit, but they can say it, they got a 1. Severe, right? They can't say it at all, or this blah, 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 right? It's incomprehensible. 2. And of course, you just put an X on this one if they're intubated or something, you know, in their mouth and they can't say it. So the last one that I'm going to talk about here is extinction and inattention. This is where they may not be aware of half of the world, right? It's an odd thing, but it's like 1/2 of everything they aren't even aware of. It's you can stand on one side of the bed and you say, you know, Mr. Smith, Mr. Smith, and you're standing over here, right? And he'll look over this way for you. You touch him over here, nothing, right? They don't recognize you anything on this side, and they don't recognize anything on that side of the room, right? But they do recognize things on the other side. It's a strange thing. It's usually the right hemisphere stroke that we get these on. And what I do is I say, now you're going to raise the hand on the side that you feel me touch you. So they'll close their eyes, say, so I can touch the left hand, and they'll raise the left hand. Touch the right hand, and they'll raise the right hand. Touch both hands, they raise both hands. And you have to warn them about that beforehand. I'm going to touch one hand, or the other hand, or both hands. And you raise whatever hands you felt me touch. Right? And a lot of times they might, you know, they'll do one, then they'll do this one. Then when you touch both, they just do the one, and the affected side they don't do. They don't make that distinction. That happens sometimes, but anyway, I'll talk about the scoring here in just a minute. And then the other one is for visual. You've had them close their eyes, and you've had them do that in the touch. Now you have them look right at you, and you put your hands out like this, and you say, which hands am I wiggling my fingers? Which hand? And then they can point to it, or they can say, or they can do whatever. And then you say, now which hand? Now which? Right? And so that's the same thing. So you're going to check for that visual and that sensory recognition. So if there's no abnormalities, they got a 0, right? They get a 1 if when you gave them the bilateral stimuli, right? This, and they only said this hand was moving, or you touched both hands, they said only that hand you touched, right? Then they get a 1. And sometimes when you're testing them and they don't notice one side at all, you can actually pick that arm up and move it over to this side that they recognize, because they don't recognize this part of the world doesn't even exist. Pick it up and pull it over there, and they say, what's that? A hand. Whose hand is it? Well, yours? I don't know. Okay. And you go like this, and you pick up the other one, and, well, what's that? What's my hand? Right? So now that's a 2. When they're that bad off, that's a 2. They're not even recognizing their own body parts on that side. It's the 2. Things they're seeing and feeling they don't recognize, that's one thing. But to not even recognize your own body parts, that's a 2. Now the next thing we're going to talk about, I'm going to have to make another video, but we're going to be talking about the different kinds of ischemic strokes.